All right, congratulations, you made it. You're done with treatment. Super exciting. I hope that you love your new smile and your bite. So I'm here to talk to you about 5 things you need to know about retainers so you can keep your teeth straight for the rest of your life. I wish that it was just do braces or Invisalign and you're done, but that's sadly not the case. 5 things you need to know. Number 1, you have to wear your retainers. You do. There's no way around it. Your teeth will shift if you do not. The reason I know this is because I see it all the time. The first 2 to 4 weeks, you need to wear your retainers full time, 24 hours a day. The only thing you should be taking them out for is eating, drinking, and brushing your teeth. That's it. Your teeth are most prone to relapse or go back to their original positions right after braces come off. So after a month, we will look at your teeth, and if it looks good, we'll let you go to nighttime only. If you do miss a night, it's not the end of the world, but wear it the next day for sure, and then wear it through the night, just to make sure your teeth stay nice and stable. After around 2 to 3 years of wearing it nighttime only, you can cut back to 2 to 4 nights per week, but not until you hit that 3-year mark. Even when you're wearing it 2 to 4 nights per week, that is at a minimum. It will never hurt you to wear more than that. It will hurt you if you wear it less than that. And even with retainers in your mouth, there are some times where the teeth will still have little tiny movements within the retainers. I tell people that this is very natural. Your body kind of wants to find an equilibrium on how the new bite fits, how the teeth line up. As long as you wear retainers really, really well, the teeth won't get far. Even if you notice little tiny shifts in your teeth, continue wearing your retainers. It's super, super important. All right, the second thing to know about your retainers is this. They will break at some point. They're made out of plastic, so you can kind of see this is a typical retainer that we use here. The nice thing about these retainers is they're really clear, so they're not noticeable, but also that they keep the teeth very, very tightly held because they're very intimately fitted to your teeth. So they'll work very well, but on the flip side, you are gonna break them at some point. Your job is gonna be, when it does break, to get it replaced. But there's certain levels of the retainer breaking that you just need to know about. Some are a big deal and some aren't. If the retainer begins to crack in one little area and it's just a little crack, keep wearing it. It's fine. It'll work great. Don't worry about that. If the crack begins to wrap around from one side to another, and you start to see it's kind of getting bigger and bigger, and it's almost as if the retainer is almost in 2 pieces, that's when you might want to come see me so we can get a new one placed. If you start to notice that little crack on one side though, what I want you to do is start pulling the retainer out from the other side, because every time you pull it out on the side that the crack is located, it's going to continue to want to make it bigger and bigger. Remember, small cracks, don't worry about it, continue wearing it. Even if you start wearing a hole through your retainers, don't worry about it. It's still gonna work. Everybody's a little bit different with how fast they go through these. Some people, retainers last 10, 20 years. With other people, it lasts 3 months. It just depends on a lot of things. It depends on your bite, your teeth. If you grind, lots of grinders go through retainers very quickly. I would say it's better to grind through plastic than it is to grind through your own teeth and then need a bunch of crowns in your mouth. It's less expensive for you to invest in a new piece of plastic for your teeth to keep your teeth straight than it is to reinvest in full braces or Invisalign again. Number 3, if your retainers start to feel tight, you need to wear them more. So this is really important. When your retainers feel tight, it just means that your teeth are trying to move. So if you can fit them in all the way, you're still okay. That just means wear more. You're still in the stage where the retainers can kind of push things back for you. And that's a really great stage to be in. If you miss a period of several weeks and you can still get it in, keep wearing it as much as you can. Just make sure it's seated all the way to see if it can shift your teeth back. If you can't get it in at all, that's when you need to see me right away, so we can make new retainers so that your teeth don't shift anymore, or you need to open the idea of braces to fix whatever teeth have shifted. Number 4, if you lose your retainer, call us right away, because teeth will shift. So you never want to get to the point where you lose it and then you don't get around to calling me for another month or 2, and then you come in and your teeth have shifted. There's not much you can do with a new retainer to shift them back, predictably anyway. Usually if you want your teeth shifted back at that point, we need to reopen the idea of braces again. If you lose your retainer, call us the same day, right? Or the next day if you want to give yourself a day to look for it. And then we want to get you in within the week at the latest. Couple other bonus tips for you. If you do have a metal bar on either your upper teeth or your lower teeth, most of the time we're going to give you a clear one that goes over the top of it. So if the metal bar comes out, or if it breaks in any way, keep it. Make sure you bring it in so we can re-glue it for you. It's okay not to get in right away if your metal bar comes out, but only if you continue wearing your clear retainer over the top of your teeth. Your clear retainer will hold things while we're waiting to get you back in to re-cement. Next tip, how to clean your retainers. I get this question all the time. Just using a toothbrush and some water is really gonna be your best bet. You can use toothpaste, but I usually advise people to use it on the inside of the retainer rather than the outside. And the reason is sometimes there's abrasives in toothpaste that can kind of scratch the surface of the retainer and just make it a little bit more cloudy in appearance. If it's starting to smell a little funny, then what you can do is put it in some scope for a little bit of time. I wouldn't leave it overnight in scope ever, because first of all, you should be wearing it overnight. But secondly, sometimes if you leave it in kind of a pigmented solution like that, it can pick up the color of it quickly. What you want to do is just put it in for just a short period of time, 10-15 minutes at the most. There are some products out there that are specifically designed for retainers that you can look up and buy over the counter, or bring it into your next visit or drop it off. We have something called an ultrasonic that helps clean retainers super well. Here, it doesn't take very long for us to do it, 10-15 minutes at the most. All right guys, I hope these tips helped you with your retainer use and some of the protocol that we have here, because I really am interested in making sure that you keep your teeth straight for the rest of your life. If you have any questions, please let me know. Thank you guys again, and be well.